Hi everyone, welcome back to my YouTube channel and today we are going to talk about Erythema Multiforme. So let's start the topic with introduction. Erythema Multiforme is an acute immune-mediated condition that is characterized by distinctive target-like skin lesion and in some cases mucosal involvement. It is considered a hypersensitivity reaction triggered by infection, medication or other stimuli. Erythema multiforme is self-limiting in most cases but can range from mild cutaneous involvement to severe mucocutaneous disease. Causes of erythema multiforme. It may be caused by infection, medication, or there are other triggers. Infections are most commonly associated with Herpes simplex virus, and other infections contributing to erythema multiforme include Mycoplasma pneumoniae, adenovirus, and fungal infections. Medication that may cause erythema multiforme include antibiotics like sulfonamides and penicillin, non-steroidal anti-inflammatory drugs, and anticonvulsants. Other triggers for erythema multiforme are vaccinations and malignancies, even though malignancies are a rare cause of erythema multiforme. Pathophysiology. Immune-mediated reaction involving cytotoxic T cell attack keratinocytes that express viral or drug antigens and that lead to apoptosis of epithelial cells and formation of characteristic lesion that is in the erythema multiforme. Clinical features. There are skin lesions, then there is mucosal involvement, and then there are systemic symptoms. Skin lesions include symmetrical distribution that are often on extremities, and there's classic target or iris lesion with concentric rings that are red outer ring and pale center in the skin lesion. And the lesion may be macules, papules, or vesicles. Talking about mucosal involvement, if oral cavity is involved, there is painful ulcers, blisters, and erosions. If lips are involved, there is crusting and bleeding of the lips. If eyes are involved, there is conjunctivitis and keratitis. And if genital mucosa involved, there is painful erosions. Systemic symptoms often include fever, malaise, and lymphadenopathy in severe cases. Types of erythema multiforme. There are two types: erythema multiforme minor and erythema multiforme major. Erythema multiforme minor is a mild self-limiting condition, and in this skin lesions are there but with little or no mucosal involvement. In case of erythema multiforme major, it is severe with extensive mucosal involvement, and it may overlap with Stevenson-Johnson syndrome. Diagnosis is done by clinical examination, that is to identify target lesions and mucosal involvement. History is important part of diagnosis that include recent infection or drug exposure. Then there is laboratory tests that are not specific but may help rule out other conditions. And then there is biopsy that show necrotic keratinocytes and lymphocytic infiltration. Treatment and management. First doctor can do is supportive care that include analgesic and antihistamines for symptom relief and topical anesthetics for oral lesions. Second doctor do is elimination of trigger, that is discontinuation of offending drug or treatment of underlying infection. Third, doctor can do prescribe antiviral therapy, that is cyclovir for recurrent herpes simplex virus associated erythema multiforme. Doctor may prescribe corticosteroids depending on, sometimes it is used in severe cases, though it is controversial in use. In case there is severe mucocutaneous involvement, hospitalization can be done, similar to Stevenson-Johnson syndrome. Prognosis of erythema multiforme. In case of erythema multiforme minor, it usually resolves within 2 to 4 weeks without scarring. In case of erythema multiforme major, they are more severe and may require intensive care. Prognosis depends on extent of mucosal involvement. Recurrence in this is common, especially in Herpes simplex virus associated cases. Conclusion of this lecture video. Erythema multiforme is an acute hypersensitivity reaction that characteristics target lesions and potential mucosal involvement. While most cases are mild and self-limiting, severe forms can cause significant morbidity, and identifying and eliminating triggers along with supportive care are key to effective management. Awareness of its clinical spectrum is essential to distinguish erythema multiforme from more severe conditions like Stevens-Johnson syndrome. And this was all about erythema multiforme. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.